Breathing is something we often take for granted, but what if your lungs are silently crying out for help? Picture this. Every inhale you take is like a whisper from your body, telling you something important. But are you listening? Imagine the daily activities you love becoming a struggle. Do you ever feel short of breath after climbing a few stairs? Or perhaps that persistent cough just won't go away. These are not mere inconveniences. They could be red flags waving right in front of you. As we dive deeper today, think about the last time you truly checked in with your lungs. When was the last time you considered what pollutants might be lurking in your environment, or how your lifestyle choices could be affecting your respiratory health? Stay with us as we reveal the subtle signs that your lungs may be in distress, and the powerful steps you can take to cleanse and rejuvenate them. It's time to reset your attention. Your body is speaking, and it's crucial to understand the message. Are you ready to uncover the truth? Let's explore the signs that demand your immediate attention. Symptoms indicative of pulmonary problems. Persistent cough can be a significant red flag when it comes to lung health. Unlike a typical cough that resolves quickly, a persistent cough lasts for weeks and can produce mucus. This symptom can indicate various pulmonary issues, ranging from infections to chronic conditions. It's important to pay attention to the nature of the cough, whether it's dry or productive, as this can guide healthcare providers in diagnosing the underlying problem effectively. Shortness of breath, or dyspnea, is another critical symptom that should not be ignored. It can manifest as difficulty breathing during physical activities or even at rest. This sensation can range from mild to severe and may be accompanied by a feeling of tightness in the chest. Individuals experiencing these symptoms should seek medical attention, as they could be indicative of serious conditions like chronic obstructive pulmonary disease, COPD, or pulmonary embolism. Wheezing and labored breathing are also signs that something may be amiss in the lungs. Wheezing often sounds like a whistling or rattling noise during exhalation and can result from constricted airways. This symptom is commonly seen in conditions like asthma and bronchitis. It's essential to monitor these symptoms, as they can worsen over time if not addressed promptly. Another common symptom that can signal lung issues is an increased effort to breathe, often described as breathlessness. This can make everyday activities, such as climbing stairs or walking, feel daunting. The body may be working harder to get enough oxygen, which can lead to fatigue and decreased quality of life. Recognizing this symptom early can facilitate timely intervention and management. Finally, if any of these symptoms are persistent, it's crucial to consult a healthcare professional for evaluation. Early diagnosis can lead to better management of potential lung issues. Healthcare providers may recommend a range of tests to determine the underlying cause of these symptoms, helping you understand your lung health better. Risk factors and common causes. Environmental pollutants and cigarette smoke are two of the most significant risk factors for developing lung problems. Exposure to pollutants, such as those from industrial settings or vehicle emissions, can irritate the lungs and lead to chronic conditions. Cigarette smoke contains harmful chemicals that can damage lung tissue, leading to diseases like emphysema and lung cancer. It's vital to minimize exposure to these toxins to maintain lung health. Pre-existing respiratory diseases, such as asthma and chronic obstructive pulmonary disease, COPD, also elevate the risk of lung problems. Individuals with asthma may experience frequent flare-ups, leading to airway inflammation and restricted airflow. COPD, a progressive condition characterized by airflow limitation, can exacerbate symptoms over time, making it crucial for those affected to manage their condition effectively. Recurrent respiratory infections can further compromise lung health. Conditions like pneumonia and bronchitis can cause temporary lung damage, but frequent infections can lead to long-term complications. Those with weakened immune systems or underlying health issues are particularly at risk. Preventative measures, such as vaccinations, can help reduce the incidence of these infections. Family history plays a significant role in determining an individual's risk for lung diseases. Genetic predispositions can increase susceptibility to conditions like asthma or fibrotic lung disease. Understanding your family medical history can help you and your healthcare provider assess your risk and make informed decisions about monitoring and preventive care. Lastly, age can also be a factor in lung health. As people age, lung function typically declines, making older adults more vulnerable to respiratory diseases. Regular checkups and awareness of symptoms become increasingly important for this demographic. Making lifestyle changes, such as quitting smoking and maintaining a healthy diet, can significantly impact lung health at any age. Importance of regular checkups. Regular health checkups are crucial for monitoring lung function and identifying potential issues early on. One common test used is spirometry, which measures how much air you can inhale and exhale and how quickly you can do so. This test can help identify obstructive or restrictive lung diseases, guiding further management and treatment options. Imaging tests, like X-rays and CT scans, play an essential role in diagnosing lung conditions. These images can reveal abnormalities such as infections, tumors, or structural changes in the lungs. Healthcare providers may recommend these tests based on symptoms or risk factors, providing a clearer picture of lung health and informing treatment decisions. Monitoring chronic conditions is vital for individuals diagnosed with respiratory diseases. Regular pulmonary function tests can help assess how well the lungs are functioning over time. This ongoing evaluation allows healthcare providers to adjust treatment plans as necessary, ensuring that patients receive optimal care tailored to their current health status. Early detection of serious diseases, such as lung cancer, significantly improves outcomes. Screenings, particularly for high-risk populations, can identify lung cancer at an earlier, more treatable stage. Discussing screening options with a healthcare provider can help determine the appropriate timeline and tests based on individual risk factors. Consulting a specialist, such as a pulmonologist, is also key in managing lung health. These experts can provide targeted evaluations and treatments for respiratory issues. Building a relationship with a specialist can empower individuals to take charge of their lung health through education and personalized care strategies. Strategies to clean and strengthen the lungs. Practicing deep breathing exercises can significantly benefit lung health. These exercises help expand lung capacity and improve oxygen exchange. Activities like diaphragmatic breathing can enhance lung function and promote relaxation, making them particularly beneficial for individuals with respiratory conditions. Incorporating these practices into daily routines can lead to noticeable improvements in overall lung health. A diet rich in antioxidants can also support lung function. Foods like fruits and vegetables are packed with vitamins and minerals that combat oxidative stress in the lungs. Nutrients such as vitamin C, vitamin E, and beta-carotene have been linked to better respiratory health. Making conscious dietary choices can serve as a powerful tool in promoting lung well-being. Staying hydrated is another essential strategy for maintaining healthy lungs. Adequate hydration helps keep mucous membranes moist, facilitating easier mucus clearance from the airways. Herbal teas, especially those with expectorant properties, can also aid in this process. Keeping the body well hydrated can enhance overall respiratory function and comfort. Regular physical activity, particularly aerobic exercise, plays a crucial role in lung health. Engaging in activities like walking, jogging, or swimming can strengthen the respiratory muscles and improve endurance. Exercise encourages efficient oxygen utilization, helping to maintain optimal lung function over time. Finding enjoyable physical activities can make this a sustainable part of a healthy lifestyle. Finally, reducing exposure to toxins and pollutants is vital for lung health. Limiting time spent in areas with high pollution, using air purifiers indoors, and avoiding smoking can significantly decrease lung irritation. Awareness of environmental factors and making conscious lifestyle choices can lead to substantial long-term benefits for lung health. Exposure to environmental pollutants and cigarette smoke. Environmental pollutants and cigarette smoke are significant contributors to respiratory issues. When individuals are exposed to polluted air, harmful substances can irritate the lungs, leading to inflammation and reduced lung function. Cigarette smoke contains thousands of toxic compounds that can damage lung tissues and increase the risk of developing chronic diseases. It's crucial to be aware of the air quality in your surroundings and take necessary precautions, such as using air purifiers or wearing masks in heavily polluted areas. Reducing exposure to these pollutants can significantly improve lung health and overall well-being. Pre-existing respiratory diseases. Individuals with pre-existing respiratory conditions, such as asthma or chronic obstructive pulmonary disease, COPD, face heightened risks when it comes to lung health. These conditions often lead to persistent inflammation of the airways, making them more susceptible to infections and other complications. For those with asthma, triggers like allergens, smoke, and exercise can exacerbate symptoms and lead to severe episodes. Understanding the management of these conditions through medication and lifestyle changes is vital for maintaining optimal lung function and preventing further deterioration. Recurring respiratory infections. Frequent respiratory infections can take a toll on lung health over time. Conditions like bronchitis and pneumonia can lead to scarring and reduced lung capacity if not properly managed. Each infection may compromise lung function, making individuals more vulnerable to future infections. It's essential to recognize the signs of respiratory infections early and seek medical attention promptly. Strengthening the immune system through a healthy lifestyle and vaccination can also help reduce the incidence of such infections, ultimately supporting better lung health. Family history of lung diseases. A family history of lung diseases can indicate a genetic predisposition to respiratory issues. Individuals with relatives suffering from conditions like asthma, lung cancer, or pulmonary fibrosis may be at a higher risk of developing similar health problems. Understanding this genetic link is important for proactive health management. Regular checkups and screenings are beneficial for early detection and intervention. Sharing family medical history with healthcare providers can assist in creating a tailored approach to monitoring and maintaining lung health. Recognizing the factors that contribute to lung problems is essential for prevention and management. By understanding the risks associated with environmental pollutants, pre-existing conditions, recurring infections, and family health history, individuals can take proactive steps to protect their respiratory health. Regular medical checkups and a healthy lifestyle can significantly contribute to maintaining strong and healthy lungs. Regular examinations play a crucial role in maintaining lung health. They allow healthcare providers to assess how well your lungs are functioning and identify any potential issues early on. One of the primary tests used is spirometry, which measures the amount of air you can inhale and exhale, as well as how quickly you can do it. This test is essential for diagnosing conditions like asthma and chronic obstructive pulmonary disease, COPD. By understanding your lung function, doctors can tailor treatment plans to suit your needs. In addition to spirometry, imaging tests such as X-rays and CT scans are vital. These exams provide a visual representation of your lungs, helping to identify abnormalities like tumors, infections, or structural changes. Early detection of such issues can significantly improve treatment outcomes. For instance, finding lung cancer at an early stage often leads to more effective treatment options and better survival rates. Monitoring chronic conditions is another key aspect of regular examinations. If you have a pre-existing lung condition, routine checkups are essential to ensure that your condition is stable and not worsening. This ongoing monitoring allows for timely adjustments to your treatment plan, ensuring that you receive the best care possible. Regular follow-ups can also help identify any new symptoms that may arise, allowing for prompt intervention. Consulting a specialist in pulmonology is equally important. These experts have extensive training in diagnosing and treating lung diseases. They can offer insights that a general practitioner might not provide, such as the latest treatment options or emerging therapies. Building a relationship with a pulmonologist ensures you have a go-to person for any lung-related concerns, making it easier to manage your health effectively. Finally, regular examinations instill a sense of proactive health management. When individuals understand the importance of monitoring their lung health, they are more likely to engage in healthy habits and lifestyle modifications. This proactive approach can lead to a significant reduction in the risk of developing severe lung conditions in the future, ultimately enhancing the quality of life. As we wrap up today's discussion on caring for your lungs, let's take a moment to reflect on the signs we explored. Remember, our lungs are vital organs, tirelessly working to keep us alive. Did you notice any early warning signs in your own life? Coughing more than usual? Feeling short of breath? These could be your body's way of saying, "Hey, I need some help here." Now, think about the simple actions you can take every day to support your lung health. Are you drinking enough water? Have you considered incorporating more fruits and vegetables into your diet? What about quitting smoking or avoiding secondhand smoke? Every small change counts and can lead to big improvements. And don't forget to practice deep breathing exercises. They're not just for yogis. Breathing deeply can help clear out your lungs and fill your body with fresh oxygen. Why not take a minute right now to inhale deeply and exhale slowly? Feel the difference? Stay tuned for our next video, where we'll dive into more ways to boost your health and well-being. What topics do you want us to cover next? Drop your thoughts in the comments. Remember, your health is in your hands, so let's keep those lungs happy and thriving.